The Philippine Nurses Association of Nevada now brings you FilipiNars. News, interesting features, and events in the nursing community and beyond. Hosted by Doris Bauer.
Hello to all of you FilipiNars listeners. I hope you had a good week. Thank you again for joining us for this episode. This is your host, Doris Bauer from the PNANV, or the Philippine Nurses Association of Nevada. Today, we have another interesting topic to explore. That is the minority nurses. In our healthcare and nursing industry, we are privileged to have a melting pot of caregivers from different races and cultural backgrounds. You can just look around when you go or you enter into a healthcare facility, and you will interface with caregivers who come from all over, especially the nurses. As we see a lot of minority nurses delivering patient care, we are also seeing an increase of minority nurses who are becoming interested in shaping healthcare policies. Many nursing organizations have increased their efforts to prepare their members to be advocates for their patients. Minority nursing organizations also share this advocacy to improve the health and the well-being of communities of color. There is a coalition of minority nursing organizations. It's called NCEMNA, NCEMNA, which stands for the National Coalition for Ethnic Minority Nursing Associations. Today, we have guests who are very active members of NCEMNA. Dr. Debra Toney, welcome Dr. Toney, and Dr. Alona Angosta.
Thank you.
Welcome, ladies. We are privileged to have you here. So let me just give the listeners a little brief introduction of the both of you. Dr. Debra Toney, PhD, RN, FAAN, has more than 30 years of clinical leadership in nursing and in the community. She began her career as a critical care nurse and has progressed into leadership roles. Dr. Toney got her BSN at Oklahoma University, her master's in health services administration at the College of St. Francis, and her PhD in human sciences with specialization in healthcare administration at Capella University. Dr. Toney is the Director of Quality Management of the Nevada Health Centers, which is comprised of 18 health centers, right, Dr. Toney?
Yes.
Yeah, cool. And Dr. Toney is also the current president of NCEMNA. Welcome, Dr. Toney. Do you have anything to add to that?
Well, no, you did a good job. Thank you. It's good to be here.
Yeah, that's a hard act to follow, eh?
Very.
Okay, well, Dr. Alona Angosta is our other guest. She's also a PhD, an APRN, an FNP, and an NPC. Dr. Angosta is an associate professor and the graduate coordinator of the Masters in Nursing program at UNLV School of Nursing. She got her PhD at the University of Hawaii at Manoa. She is board-certified family nurse practitioner, and she is the current president of AAPINA, AAPINA, which stands for the Asian American Pacific Islander Nursing Association. Is that right?
Correct.
Welcome, Dr. Angosta. You have anything to add to that?
No, you did good. Thanks.
Well, because I did my homework. Okay, so today we're going to be talking about minority nurses and your coalition, NCEMNA. So what is NCEMNA and who are its members?
NCEMNA is a coalition of associations, so we don't have individuals that are in it, but it's the association. And our members are 5 national ethnic minority nurse associations founded back in 1971. So NCEMNA is 21 years old.
Wow.
Yes. Yes. So we have members benefit from belonging to their professional association. And then in NCEMNA, as we all know, oftentimes minorities, I'm going to say, is at the end of the line, or there's challenges, or maybe there's not enough. Some groups and some associations are larger than others. That way we're able to empower and to assist each other to really leverage what we want to do, whether it be resources to pull all the nurses together, because what we find is that there is a common bond. The challenges that may be in the National Black Nurses Association population or the African American population, we often find in other populations, whether it's the Asian and Pacific Islanders, the Hispanic population. So we pull ourselves together and our resources together for the better good.
That's excellent. That's excellent. So I just recently heard of NCEMNA, and I didn't know it was 21 years old. So I'm really excited to feature this here at our program. So what are the goals of the coalition, Dr. Toney?
The goal of the coalition is to be a unified force. And really, our whole mission objectives are all focused around equity and justice in healthcare. We, again, like I said, we bind ourselves together because one organization cannot do it alone. But that is our focus, diversity, inclusivity. When we first started, we were involved in increasing the number of minority nurse scientists and researchers, where we provided them with mentors to help them get through their PhD programs, to help them with their research projects. So we have what we called NCEMNA Scholars, and that's what we've done for several years. But as the environment changes, so does everything else. So I'm not going to get into some of the other stuff because I know you're probably going to ask me some questions about that. But like I said, NCEMNA's been around for a very long time, and it's a powerful organization. We represent over 350,000 ethnic minority nurses, those that belong to and those that don't belong. So I always tell people, if you don't belong to your professional ethnic organization, we're going to speak for you. We're going to represent you. We're going to talk about those things that we have identified as being important and critical to the survival of populations. So you may as well join in.
Right.
Be at the table and let your voice be heard.
Be at the forefront. And this is actually one of my goals with this broadcast, is to raise awareness with minority nurses, and maybe even not only the minority nurses, but to raise awareness that they need to be involved in some of their professional organizations. So.
And you know, Nevada is a little more unique, let's say Las Vegas. And I say that because, and you're doing your research, and it's good to get the information out there, but how many people, how many nurses here in Las Vegas or in Nevada knew that you have a past national president of the National Black Nurses Association? You actually have a current president here in Las Vegas of AAPINA and a past president. So nobody knows that. And these are the minority nurse leaders who represent established policies, what the goals are going to be, what the rules are going to be, what the standards are going to be, and they're right here at your fingertips.
Right, and we're pretty lucky, and I guess we need to disseminate that information. We were talking about mentorship and maybe having a list of like mentors, to go around. That was a couple of episodes ago, and hopefully, we can make that happen. So that's really great. Do you have any statistics of any minority nurses in the healthcare industry here in Nevada or in the U.S.?
So when you asked me this question, and I did ask, I did my research, a little bit of my research too. So in terms of the statistics in Nevada for nurses, as of 2015, that's the only year that's available. I think the most current ones are being worked, and it's from the professors at UNR. They're the ones who are giving me these statistics. 2,983 nurses in Nevada as of 2015, and I'm sure there are more. In terms of the U.S., I don't have the current statistics for that, but we can find out.
Yes,
sure.
We definitely can find out. I was looking at the Minority Nursing magazine also, and it's saying that there's about 20% of RNs in California are Filipinos. And there is a statistics, I think this was a couple of years back, the race and ethnicity statistics that not everybody self-identify to be where, which minority culture they come from. But it looks like at the last count, there were 9.9% of RNs identify themselves as, African American and non-Hispanic, and there are 8.3% Asians and 4.8% Hispanic or Latino. So that's, very, I'm sure those statistics are not current. And so...
And they may be a little bit behind, but how we think things have changed, they really haven't changed. Hispanic nursing population, while the population is soaring in growth, the population of the nurses have not.
Yes.
The nurses have not.
And that is concerning because now we have the baby boomers coming, and then the slow growth in the nursing profession is actually going to impact that in a negative way. So we should find ways to increase that growth as well.
Yeah, I totally agree. So, Dr. Angosta, how has, in your opinion, AAPINA's membership to the coalition helped the organization?
Our organization, even though it's national, it's very small compared to other organizations in the coalition. And many of our members work in silo. And one of the challenges that we have is to increase visibility. And the benefit of being active in NCEMNA is to help increase that visibility and to have more power because, for example, the NBNA, Nurse Black, the National Black Nurses Association has 150,000 members as opposed to us with 200 or 300 members.
Yes,
So that's the main benefits right now.
All right, so NCEMNA had the first Public Policy Leadership Summit just last Monday.
Yes, we did.
Yeah, I wish I could have gone, but I had some personal issues. I couldn't. So before we delve into that, let us take a pause for a minute for our news report for this week.
Thank you, Doris. The National Coalition of Ethnic Minority Nurse Associations convened on March 25th this year in Los Angeles, California, a public policy leadership summit themed Nurses Transforming Healthcare in Diverse Communities. Keynote address was presented by Dr. Catherine Alicia Georges, AARP's National Volunteer President, along with NCEMNA Association Presidents. NCEMNA is comprised of 5 national ethnic nurse associations and is a unified force advocating for equity and justice in nursing and healthcare for ethnic minority populations. For FilipiNars, this is PHLV Radio.
Thank you, Johan, for that. So, being that you held the first public policy summit in Los Angeles, can you tell us about the theme and what happened at the summit?
Our, we like to call it our inaugural leadership summit. It is something we're going to continue to do.
Great.
The board will be taking a look at, what did we like about it? What would we change a little bit? We had a phenomenal response. But the real crux of it is there's so much going on around us, period. In the U.S., all over, we have board members are here on the West Coast, they're on the East Coast, they're in the South, they're everywhere. Again, those commonalities. So when we start talking about policy, again, we are the policy makers. We set the agenda for ethnic minority nurses.
Right.
Again, a plug for people to join in with us. But also, we just wanted to share who NCEMNA is. Again, like I said, NCEMNA originated, we were doing increasing scientists and that type of thing. We know with the Future of Nursing report and all the messages that they have received, we want to be right in the middle of that as it relates to minority nurses and diversity. So we all came together, and you have to keep in mind what's really important to NCEMNA is our ethnicity. What are those things that we specifically have, and knowing the intricacies or the little bitty fine details of what happens in the community. We know what those are because that's who we are. And as nurses, we're good at assessing and putting all of those type of things together. But again, it was to share with the public that we are here. The last few years, there's been infrastructure and building and those type of things. But we felt this was a perfect time to come out and just share with everyone. We have one of our members actually from the National Association of Hispanic Nurses is actually on the committee, the new committee for 2020 to 2030.
2030.
The future of nursing.
20 to 2030.
So we feel very privileged to have that and to be able to impart things that are important to our communities that she can share back with the association. But we had speakers, renowned speakers. Our keynote speaker was Dr. Cialisa
Georges.
Boy, I tell you, thank you. Cialisa Georges.
Very powerful.
Who is the national president, volunteer president of AARP, the largest membership organization that we have here, as well as a past president. I like to make sure everybody knows, a past president of the National Black Nurses Association. So it was all of those type of renowned, powerful people. We did a section at our luncheon on nurses on boards. And we actually had the chair, Kimberly Harper, the national chair of Nurses on Boards Coalition. So for those that didn't make it, they really kind of missed out. And Doris, that means you too, so you'll have to come next year.
I'm going to have to come
You
next
should.
year. Yes.
Maybe, who knows? Maybe we can do it in Nevada.
Can we do it here?
Right.
No, I had some.
Oh no, I'm just teasing you, but
No, I really had every intention of coming, but I had family stuff. So I read an article in the Minority Nursing magazine a while back. It was published in 2017, and it was a Q&A to minority health policy nursing leaders. And it was conducted by Dr. Janice Phillips, PhD, FAAN. So I would like to ask you some similar questions that she had asked, and to see maybe where we were like a couple of years ago and what you are doing now. So basically, I want to see what we are doing now. So the first question is: does NCEMNA or any other member organizations of the coalition have a public policy agenda?
So let me first say that Dr. Janice Phillips is phenomenal. She's a phenomenal leader. She's a phenomenal researcher, as well as a policy scholar. I know her very well.
Nice.
She's a member of NBNA.
Yes.
So we work together on quite a few projects, and she actually is the policy chair for NBNA currently right now. They just left Capitol Hill, February, which is something that they do every year. She is phenomenal. So as far as policy agendas, and it's interesting that you bring that up, we actually talked about a policy agenda as we're looking at our new goals and strategies, as well as was able to gather information from those in attendance. But now what I can tell you just real clear, the number one thing everybody unanimously pretty much gave us the direction that health care for all, that it is a right and not a privilege. So it's those type of things, but that's number one. We also support the activities around the future of nursing.
Yes.
So when we talk about increasing education, increasing the number of, baccalaureate nurses, et cetera, just down the whole pipeline there. So there are several things. We're going to be meeting probably in a few months to do some strategic planning, to really think about what direction, what policy agendas we want to support, but then too overwhelmingly the whole full practice authority, which we got the experts sitting right here for nurse practitioners.
We do.
You know, that
We have
comes
that.
up all the time.
That was before. And that was the agenda before, but we met that, and now all nurse practitioner like myself, we do
Right.
have independent practice.
So that is really fantastic and awesome. But the one thing that I want to escalate that on the practice issue with nurse practitioners, I work in home infusion. And when you are, and correct me if I'm wrong, if your insurance is Medicare, they do not want, or how should I say this? It's still a physician. They still look for the orders of a physician. So I need that to be escalated, or we need it to be escalated. Wherein Medicare will actually recognize, the APRNs, the NPs, and have them write, prescriptions and fully take care of the patients. So I think that's one thing that needs to happen.
Absolutely. Things like this can be brought to the Board of Nursing. I used to serve for the Nevada State Board of Nursing Advanced Practice Committee, and so the public, when they have questions or requests like that, and then we bring it to the committee, and then we discuss it during our meeting, and then that's basically the start of the conversation, and then it can be escalated.
That's
So
good.
It was very obvious. You probably remember the one at the end of the summit. There was a nurse that came up, was a nurse practitioner.
Yes,
so while
the
we
California
have,
Board of Nursing.
So while we have full practice authority, everybody doesn't. And as big as California is, they do not.
They're still working on
So
that.
that's a
Yeah.
huge issue. So like you say, while we have full practice authority, we represent nurses around the world. So we still have to continue to
Advocate. for it,
advocate, help them to get what it is that they need. But it is a big issue. And here in Nevada, there's all these different little requirements, the 2 years or 2,000 hours. But then, too, I think it's something that, I don't know how it slipped through, and maybe not just here, but around the country, that there's a federal piece attached to that with Medicare. So it's the home health orders. I know there's the struggle with pushing to get the, DME and some of those type of things. And I think that falls into what you're saying as far as the, infusion therapy and some of those type of things. So while we know it doesn't fix everything,
Yes.
it's better than what we had, which was nothing.
That's right.
And especially, where I work at, we have several advanced APRNs that work for us. So just to be able to provide that access to those 18 clinics you're talking about here in Las Vegas in the
Right.
rural areas.
And the rural
and that
areas.
type of thing. But that part has been a challenge. Then you get the script and it's like,
Yeah. Actually, next week in our next episode, we're going to be exploring that rural nursing coverage as well. So,
oh, wow.
yeah. So this is cool. All right. So, what do you believe are the top policy imperatives that are impacting the nursing profession today? Well, you've pretty much a little bit honed in on some of them. And do you have anything to add with NPs, APRNs?
Well, there's still a nursing shortage.
Yeah,
Yes,
absolutely.
yes,
yes, yes.
It's still an issue, and it's going to get worse when these, like I mentioned earlier, the baby boomers are going to be retiring, and we're going to have a lot of the elderly population to take care of.
I was laughing with some of my coworkers. I said, well, I'm getting older there, but the average age of nurses are getting high up there. So here I am in my wheelchair. I'm going to wheel myself around and say, I'm going to take care of you.
Yeah.
So that is a possibility.
In fact, one of our speakers at NCEMNA during NCEMNA Summit presented the caregiving burden and caregiving issues, and how nurses are also placed in between, and that definitely impacts everyone.
Yes, and the nursing shortage, I think the latest stats are in Nevada, I think it's 700 nurses per 100,000 population.
Well, all I know is that when I was in nursing school 40 years, it was a nursing shortage then.
Yeah. It's
probably a different type of nursing shortage.
Right. It would be.
At that time than what we're going to be experiencing, just like Alona mentioned.
And then other issue is mental health. So in Nevada alone, we lack providers for mental health. So at UNLV, we're working on opening the nurse practitioner program for psych mental health. We're hoping that we could open that in the fall of 2020.
That's awesome.
What about
That's
the
great.
faculty shortage?
Yes,
And
that
faculty
too.
shortage too. In
Where are
terms
we with
of
that?
the faculty teaching nurses and also the administrative part, because a lot of our leaders are also retiring.
Yes.
So those
Yes.
are the issues, and that we're looking at with the organizations that I belong to, as well as in NCEMNA and through the university.
And people are saying that nursing is the last one of the professions that has required a baccalaureate degree as an entry level for a job. So that is really very challenging, because we have a lot of obstacles that we need to, that we come across.
Well, and you really have to be careful. I know there's a lot of other professions, like you say, they require a BSN level. The pharmacists have gone to everybody's a PharmD and those type of things. And nurses, I think we've been so versatile. We have different levels of practice, whether you're 2, 3, 4 year, etc. But you really have to be careful with that, because the number one place that most nurses start out at is an ADN program. So when we're talking about ethnic minorities.
Correct.
So being able to come in, people have families and those type of things, even more now. I went in school when I was in my 20s.
Yeah.
But that didn't necessarily happen. I mean, Alona, you probably see that yourself,
But there are a number of schools, though, that provide that, for the students with an ADN, prepared ADN, nurses to have their BSN online. So that is
Yes. So
and
they
I think
can
we have schools like
transition.
that.
Right, and that
There
doesn't
are.
necessarily diminish their capacity and their as a caregiver. So I know I'm hoping that will improve. At some point, and then what else?
Can I mention something? In
Sure.
terms of the AAPINA, our organization, national, because the national also has 3 chapters. So there's AAPINA of Nevada, who also comes here every Mondays. But in terms of the national policy agenda, it's the lack of access to healthcare for everyone, not just for the Asian American population, Pacific Islander populations, but pretty much throughout. Among the minority organizations as well and members. So and that's a common theme that NCEMNA and all these organizations have.
That's correct.
Yes.
That's correct. So how does NCEMNA or the member organizations sort of like prepare their members to become influential advocates in healthcare policymaking arenas?
I'll say, just NCEMNA as a whole, we have what we like to say developed and assisted move forward several nurses just through our scholar program. Each organization has their own programs. I can speak for MBNA in that as a past president, I created the MBNA Founders Leadership Institute. So that institute is where we actually worked with had a mentor type program. They were able to be buddied with a seasoned nurse in whatever field they were interested in, but to really try to help and guide them. And we also, all the way down, we have a children's, and I created that too. I'm proud of those 2 programs, was a youth enrichment summer institute. So every year at our conference, we have a program for young people. They attend the conference, they do all of those type of things. So we actually pull them together and encourage them, in the health professions and that type of thing. And then, all of us, most of us are involved with Nurses on Boards.
Yes.
Again,
Yes.
preparing nurses, and we do those type of things through our Leadership Institute as well as through our President's Workshop to really prepare our members to take on leadership roles.
Leadership roles. Okay. Yeah, that's great. You mentioned a little bit about the FON, the Future of Nursing reporting. Is this available, and how do we know that the Future of Nursing report is available to all of the nurses? How do we disseminate that information?
The Future of Nursing report has been out since, 2010?
2010.
So it's widely available. This next report, that again, over a 10-year period of time, is going to really be to evaluate that process and that program. So again, housed at the former Institute of Medicine, what is this, a National Academy of Medicine, where they'll actually be looking at that, evaluating, was it really effective? So a lot of the tenets are pretty much the same, but again, they've gone through, and people can go online, they have a webinar to hear the different testimony and that type of thing as far as the future of nursing. And through, of course, the driver of all of that, as you know, Doris, is through the Nevada Action Coalition.
Right.
It's where we have some phenomenal individuals, and I want to give let me give a shout out to Debra Collins and Linda Pollock.
This is the second time we're calling them out.
Who really carry a heavy lift on that. But again, that is how the different states, because all of the states have action coalitions,
right.
But that is actually how they move their agendas, their measures, their tactics, that type of thing.
And we are going to have Linda and Debra here at some point. We have to come to an agreement on what they want to talk about. So I know we called them out when we were talking about raising the bar for nursing excellence with when Dr. Fouts was here. So, okay. So you talked a little bit about healthcare for everyone. In your opinion, how does the ACA or the Affordable Care Act impacted our minority communities? Do you want to talk about that, or?
So, the Affordable Care Act, I really think it was a good thing. Like I said, I work at a federally qualified community health center. It's federally funded through HRSA, large grants, etc. But a lot of those opportunities for everyone, as much as possible. We know there are still individuals that don't have insurance, but people who haven't had insurance in years, it does afford them that. One of the big pieces that comes with that is while they may not, whatever habits and behaviors they created before they had insurance, those behaviors still exist.
Correct.
So it requires a lot of education to get people to change behavior. So if you're used to going to the emergency room all the time for primary care,
right.
But you have a provider now, whether it's a physician, a nurse practitioner, physician assistant. So I think it was good. Also, a lot of people benefited from being able to keep their children on their insurance for a much longer period of time. And who wouldn't like to not deal with pre-existing
conditions? Yeah. And I think with it, with the inception of the Affordable Care Act, we've seen a decrease in the uninsured population. So, and also I've been hearing from people as well that the language portion of it, they have a lot more language assistance to help the minority population in getting health care. So I think that's one of them. I mean that's a good point in itself. Okay. So is membership to a professional organization helpful for nurses? What are the benefits, and what can you advise our nursing listeners for that?
Yeah, I think being a member of a professional organization at national and international levels are very beneficial because of the, they're going to be able to represent and be and also represent nursing, and as well as being up to date with the policies in terms of the changes in the healthcare system. And you mentioned something about a question about, for nurse leaders, how they become involved in health policy changes is to, be able to step up and serve on the board, for example, for Nevada State Board of Nursing, or for professional organizations, because a lot of the minorities, nurses, I'm speaking about, the Asian Americans, not a lot of them are stepping up because we tend to work in silo, and I think that's more cultural, right?
Right.
So I think we need to step up and be involved. And one of the things that I'm thinking is that raising awareness. For example, this radio event like this, inviting us, and then raising awareness to other minority nurses. This is possible.
It is possible, right?
But we need a number, like, partnering with big organizations like NCEMNA,
exactly.
AARP, and that's
Red
basically
Cross,
right.
And community organizations as well.
Right, and that's basically what we're doing at AAPINA National. That we've revitalized our relationship with NCEMNA and connected with AARP as well. Campaign for Action.
Campaign for Action.
Yeah,
And
thanks.
I like to share with students when I'm speaking with them when it comes to associations, or just people that may not understand, because, of course, I'm a big proponent of associations. But you need to be a part of your state association. You need to know what's happening in the land that you live in. That's number one. You also need to be engaged and belong to your specialty. So if you're a specialty nurse or APRN, cardiovascular, infusion, you need to belong to your specialty, so you're up on top of everything that's happening with evidence-based practice in your practice area.
Right.
That's how you get paid. That's what you do every day.
That's true.
When you go to work, and then you need to belong to your ethnic association.
I totally
because
agree.
you need to be able to know how to move around in these other areas we just talked about, and to learn and to know what's important to the group that you belong to, where you live, work, and play. So that's how I like to explain it, because I think you need all three. I know I do.
And actually, you mentioned the state nursing organizations. We need to also advocate for the state organization to include the minority nursing associations as part of their affiliate, in order for everyone to be heard, and especially helpful in making policy decisions.
Yes.
Okay. All right. So, what's the future for NCEMNA?
Well, and Alona's probably just going to laugh. As president of the National Coalition of Ethnic Minority Nurse Associations, I have big plans. I don't want to tell all the secrets right now.
You always have big plans.
But Alona is right there. So there's just a lot of things we're looking at doing, whether it's on the policy front, whether it's on the practice side. Again, wherever there are things happening and you're talking about diversity, inclusivity, equality, equal justice in healthcare, we plan to be there. Because, again, number one, we are the authentic voice. I just cannot not say that enough. And that our mission is a unified force advocating for equality and justice in healthcare, period. That's what we do, and everything that we put our hands on, what we touch, that is what it is. That's what people will see.
Absolutely. So, the contact information for NCEMNA members, AAPINA, you have www.apina.org. The NANAINA, www.nanainanurses.org. We will put this out there.
Okay.
And then the Hispanic nurses, it's www.thehispanicnurse.org. and the NABN. We also have the Southern Nevada Black Nurses Association in here, which is very, very active.
Right. Yeah, absolutely.
Yeah. So it's www.nbna.org. And the PNAA, which is the Philippine Nurses Association of America, it's www.mypna.org. And of course, our local Philippine Nursing Association of Nevada. You can call us or you can go to www.PNANV.org. So anything else that I missed, I think?
Well, I think you pretty much covered it.
Everything.
Okay, great. Well, so what are your parting words?
For me, my parting words for our fellow nurses is to be actively involved. And many times nurses get to be dedicated and focused in working and not being able to be actively involved and not engage or updated with current policy. So I think being actively involved in state organizations as well as professional organizations are very important.
Thank you for that. How about you, Dr. Toney?
And my last word would be to engage, reach out. I don't think anybody's going to go to your door and knock on it and say, hey, come on out of there.
That's true.
Serve on a board.
Yes.
Be at the table. And really let your voice be heard. And then most importantly is join your ethnic minority nursing association.
Yes. Fantastic. So, okay, so listeners, FilipiNars listeners, there you have it. Thank you so much to Dr. Toney and Dr. Angosta.
Thank you.
I'd like to thank you both for agreeing to come here to our podcast. And you have imparted so many really valuable information today, and I'm so glad. So I hope this program has created awareness to all nurses, whether you are a minority nurse or not, that your involvement in making changes in healthcare policies is extremely important. Find that passion in you. Join your professional nursing organization. Speak up so you can be heard. Also, please share this broadcast to any nurse you know. We would love to have your feedback, encouraging you to make a comment when you access the broadcast on the PHLV Facebook page or other podcast avenues like iTunes, iHeartRadio, or Spotify. So thank you so much again for listening. Until next week, this is Doris Bauer, your FilipiNars host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you FilipiNars. News, interesting features, and events in the nursing community and beyond. Hosted by Doris Bauer. Fridays, 7 p.m. Pacific on PHLV Radio.